Namaste everyone. My name is Divya. I am a PharmD student. Also, I have completed my bachelor's of pharmacy and on this channel I share easy exam friendly explanation of important clinical topics. So, today we are talking about hypertension as it is one of the important chapter of cardiovascular system. So, hypertension, commonly known as high blood pressure, is a condition in which the force of the blood against the artery wall is consistently too high. Over times, this increased pressure can lead to serious heart complications, including heart disease, stroke, and kidney problems. Blood pressure is measured in millimeter of mercury and recorded as two number, systolic and diastolic. Systolic is the top number and the diastolic is the bottom number. Here we can see, like I have defined, like what is hypertension. Like hypertension is defined as persistently elevated arterial blood pressure. So if it is asked in exams, you can simply write this particular definition. So, next it is blood pressure categories. So, the blood pressure can be categorized into normal, elevated, hypertension stage 1, hypertension stage 2, and hypertensive crisis. In the normal blood pressure, it is 120 by 80 millimeter of mercury. In the elevated, systolic is 120 to 129 and diastolic is less than 80. In hypertension stage 1, systolic is 130 to 139 or diastolic is 80 to 89. Hypertension stage 2, systolic is 140 or higher and diastolic is 90 or higher. In the hypertensive crisis, systolic over 180 and or diastolic over 120 mmHg. Now we will have the understanding about the classification of hypertension. So there are two major type of hypertension and four less frequently found types. So those two major type of hypertension are primary, or you can say essential hypertension, and secondary hypertension. The primary hypertension, about 95% of people have high blood pressure, that is essential hypertension. Okay, and next, that is the secondary hypertension. About 5 to 10% of people have secondary hypertension. Less frequently type than those are the found types, we can say like isolated systolic hypertension, malignant hypertension, resistant hypertension, and also hypertension during pregnancy. Okay, what are the causes and risk factors of hypertension? Here we can see like these are certain amount of causes due to which a person can have hypertension. Okay, high blood pressure. Hypertension can arise from lifestyle and genetic factors, like it can also be inherited. Your unhealthy diet, lack of physical activities, overweight, excessive alcohol or tobacco use, chronic stress, family history of high blood pressure, that is the genetic factor, and it may also be secondary to conditions like kidney disease or hormonal disorders. So, these are some of the underlying factors due to which a person can have hypertension. Any questions you have, you can just simply ask me below the comment section as well. Okay. Next is the symptoms and the silent nature of hypertension. Like we simply say hypertension is the silent killer, and not because symptoms are can be seen directly. It takes time. Okay, so hypertension is the silent killer because it typically has no obvious symptoms until significant damage has occurred. Symptoms occurs like chest pain, nosebleeds, shortness of breath, headaches. All these symptoms do occur, but when the blood pressure is dangerously high, these are the certain symptoms that you can have understanding for the same. Next part, it is about the complications. If what happens if the hypertension is untreated? If left untreated, high blood pressure can lead to heart disease, stroke, kidney damage, cognitive issues. In the heart disease, it includes heart attack, heart failure, left ventricular hypertrophy. In the stroke part, due to weak or blocked blood vessels in the brain, kidney damage that is resulting in chronic disease or failure. Cognitive tissues like memory loss, dementias over time. These are certain complications that can be seen if hypertension is not treated, if the lifestyle is not modified. We have seen the causes, the risk factors. Now it is about how this blood pressure is diagnosed, monitored, how we can say like what how it is monitored to be exact. Okay, so hypertension is diagnosed by measuring blood pressure with a cuff device. Multiple readings over time are needed to confirm a diagnosis. Some people may require 24 hours ambulatory blood pressure monitoring. Regular monitoring is essential, especially for individuals at risk. Hypertension can also be related to stress. Like if a person has stress, they are not sleeping properly. So we have to monitor those particular patient as well. Okay. Next, it's about the medication and medical management. Like what can be the very first line of drugs that can be given to a patient who is suffering from hypertension? So diuretics, AC inhibitors, calcium channel blockers. See, even lifestyle changes are not enough. Medication may be prescribed. Common classes of antihypertensive drugs include diuretics, medication that reduce fluid buildup in the body, ACE inhibitors, medicines that lower blood pressures, calcium channel blockers. They stop calcium from entering the cell of the heart and arteries. So these are certain medications and medical management for hypertensions. Now we can see like how lifestyle modification can be done for better management of hypertension. Lifestyle changes are often the first step in managing high blood pressure. And these lifestyle modification includes reducing salt intake and eating a balanced, heart healthy diet. That is, you have to take a balanced diet. Engaging in regular physical activity, at least 30 minutes most days. Like at least 30 minutes of walk every day you have to do to manage this particular modification lifestyle. Maintaining a healthy weight. Okay, no alcohol or tobacco, like no intoxication to be taken for the management of hypertension. You can also work on these particular questions which are given, discuss in the next videos, as I will be explaining you about the classification of hypertension in the next video, so that you can have better understanding about the same. If you have any questions, you can just simply comment down your questions. We are definitely going to answer all your questions and queries related to those particular parts. If you like this video, kindly subscribe it, share it to your friend so that they can have better understanding about any topic that they are going through. And also, if you want if you have any query, you can also see in our description box. You can email us, you can visit our Instagram, Facebook. Thank you.